The COVID-19 pandemic has brought on many new social and economic challenges, including global economic downfall, unequal access to healthcare, higher unemployment in many countries, and of course, including our very own South Africa. And the grip of a possible longer third wave of the pandemic in the country has once more raised concern of further threat to our recovering economy, as we were told, and also an increased number of people living in poverty due to stricter level 4 regulations. So to talk to us about how COVID-19 is impacting households, balancing public health regulations while avoiding an economic disaster, we're joined by Isobel Frye, Director of Studies in Poverty and Inequality Institute. Isobel, so good to speak to you again. Welcome to Morning Live.
Sakina, hi, it's nice to speak to you.
So many people asking the question about that balance. How do we strike a good balance between following and adhering public health regulations in order to preserve lives and preserving economic activity on the other hand?
I think that you identified two tensions, but I would add a third to that. So on the one hand, it is about preserving health lives. It's about stimulating and preserving the economy. But it's also about ensuring people's well-being. And that third leg is what we are seeing in our analysis is just being kicked out. And the stool looks as if it's about to fall over. So we are slowly rolling out the vaccine as a result of the increased number, the very alarming increased number of infections with the Delta variant. We are now back into more severe lockdown restrictions. But the ancillary steps of announcing some kind of income relief for people has just been completely absent. And that's something which we can't understand, because much of our own analysis and our negotiations at NEDLAC process during the earlier lockdown phase was to say, if we want to create an economy going forward, if we want now to build the stimulus that we need, that we need to distribute income into the hands of people who don't have. As you said in your introduction, unemployment was bad to begin with. We were in a recession before we had the initial COVID lockdown. Unemployment was about 45% on the broad front. That includes people who've given up looking for work, and that's now heading towards 50%. There's the regular NIDS-CRAM analysis of people's well-being, which is due to be released in July, so in any day now, is going to show the huge increase in hunger and starvation and malnutrition. So we are trying to vaccinate people, but at the same time, we're not feeding people and we're not giving people the economic tools in which to create a stimulus. I think one of the questions that people are beginning to ask right now is what happened to the 500 billion stimulus package. And at SPII, Studies in Poverty and Inequality Institute, with Duma Kabule, we recently released a review of that money and what happened to it. And it seems that, and this goes back to your earlier question about leadership. So we have strong statements, we have bold statements, but we don't have the action that follows always. So we were told that we would have 500 billion stimulus, but if you follow the money either was promised but not delivered, or it was withdrawn. So if you look, for instance, at the loan guarantee scheme from the banks, a lot of that was spoken about. And yet when ordinary people went to try and claim the relief, they were told that it wasn't available to them. So I think at this stage, what is really lacking is an audit and analysis of what was done, what needs to be done, and how it's going to happen. But for us, the most crippling, the most cruel situation right now is that people have not been given any relief. And with the closing of the schools, that again epitomizes that tension. We're closing the schools so that the children do not get infected at school, but we're also closing down the school feeding schemes without any hint of how children are meant to obtain that one crucial meal for themselves every day.
So with all of that, Isobel, and what for me is most distressing is that we continue as if it's, life is normal, as if these things just happen in our day-to-day existence. You talk about the banks, for example, the sort of relief that people would have expected to come through, where the banks would be more understanding. They haven't been. They want their monies, and people have lost livelihoods, and they've lost what they've worked for all their lives because they stopped working and suddenly everything was taken back. The president, at the start of this pandemic, when we first went into lockdown, I remember him saying that he would appeal to the banks, to businesses, not to necessarily go on and enforce force majeures. And I remember saying at the time, why is the president appealing? Because that's not going to be enough. You can't appeal because people will do what they want to, what they need anyway. And then you have the social relief of distress measures that also didn't quite work as they were intended, and yet we go on as if it's business as usual. Let's talk about that, especially now that we are once again entering stricter levels of lockdown regulations, and people are going to be thrown back into this absolute black hole of distress once again.
I think that often our lens of analysis is based on assumptions that are not that applicable to this country. So, for instance, we know that the middle class is shrinking, and yet it's the middle class that were hit a lot with the bank foreclosures and the evictions. We know that a lot of our economic activity is informal, and yet it's the informal traders who are being hit by the lockdown regulations. We've been asking a number of civil society organizations and labor for an emergency type scheme to be set up for informal workers, because they're not able to obtain the UIF TERS because they weren't contributing, and when social relief of distress was there, they were excluded from eligibility for that as well, that meager 350, because they were trying to make a livelihood, and so they didn't pass the beans test. And so we have significant groups of vulnerability who are just excluded from the incredibly simplistic, it appears, calculation that National Treasury is doing. So we're currently engaging with Treasury on the question of the MTBPS, what needs to come into that. We're saying that we need to be relooking at the fiscal framework. We cannot be proceeding with an austerity budget. I mean, for instance, we talked about social relief of distress grants. For the next 3 years, our analysis shows that the budget's actually being cut progressively. Or should I say regressively rather than progressively. So none of this makes sense for where we are. We talk about a future, but we're not putting our money there. And in fact, Sakina, just off air, I was saying to you that a couple of people have been talking to top legal counsel to say, is there a way that we can go back to the Constitution and make the Constitution work for people? Because it's as if leadership is deaf to the realities. And it's about humanitarian, it's about human rights, but it's also about our interest in making this country continue. I mean, we see what's happening on a daily basis across the border in Eswatini, where the youth are actually taking their future into their hands. Now, we don't want to get to the situation where parts of our society are saying our leadership is not listening to us, we need to do it for ourselves, because that kind of chaos leads to destruction. As South Africa, we lived in civil war for so long. We need the elected leadership to come to the table and say, we hear you, we see your empty pockets, we see the empty shops. Now, how do we go about taking what we have and transforming it into a way that deals with the demands of the emergency that we're facing, rather than some kind of orthodox economic trajectory which has been disproven in every other country?
So, just looking at the extent of poverty in urban areas compared to rural areas since the advent of COVID-19, Isobel, how does it stack up?
The question is very related to government action. So, for instance, if you look at the poverty levels in Gauteng, they are directly linked to the levels of social grants that are being distributed, because the unemployment figures are so high that the major source of income into most households by statistical prevalence is from social grants. So when the grants were being rolled out, when the caregivers grant was being paid, the social relief of distress and the top-up, people's well-being was much better. In fact, poverty levels dropped to way below they'd been in living memory. And yet, and that shows what margins we're talking about, because the grants are minuscule, and yet the well-being increased. And the policy response to that was, well, poverty's fallen, we can remove the grants, as opposed to understanding that poverty had fallen because of the grants. So in urban areas, we have people who don't have the luxury of being able to to grow for themselves. The costs of fuel and all transport is incredibly high, and it eats into something which currently, right now, it's a miracle that people are surviving. When we look, for instance, at questions of rising petty crime, I mean, that's definitely increasing because people are taking what they don't have.
And, you know, speaking of those grants, do you believe, Isobel, that government should reinstate the unemployment relief measures just to cushion once again the impact of this third wave with the introduction of level 4 regulations?
As I've said to you in the past, I really believe that we need to have a universal basic income grant. I think that the social relief of distress that we were seeing it basically doesn't free people the way a universal basic income grant would. However, in the immediate, the answer is a resounding yes. We need to ensure that the levels of about 6 million people were receiving the social relief of distress. 7 million women were rejected in their applications for social relief of distress because they were receiving children's grants. So there's a huge amount of problems with the way that social relief of distress was configured. And yet, with regards to just the removal of it, especially given that we're going into lockdown, and as civil society, we escalated this to the top and showed the evidence. We gave the evidence. We're meant to be an empirically led country when it comes to policy making. And yet we were told there is no money. There is always money. We have a constitution that talks about available resources. We haven't tapped into any of those other resources that other countries are. If you look at modern monetary theory, for instance, that the US has taken on, all of Biden's recovery projects, well, 2 of the 3, were really funded by looking at new monetary theory. We don't do that. We just say that there is no money available. There's no money available in people's households. That's what we should be focusing on, because how do you say that we have a constitution that guarantees you dignity if we are unable to show how we recognize your dignity in being in our country?
And of course, a health pandemic. And in his address to the nation on Sunday evening, President Ramaphosa said that Gauteng had made available 830 additional beds by postponing elective surgery. The province is engaging with producers of medical oxygen to increase the production so that they can accommodate the anticipated increase in cases. But what has the cost of receiving proper health care been for ordinary South Africans?
I think the assumption there is that ordinary South Africans have received proper health care. I have to say that the state hospitals have really shone in using the limited resources they have. But what we've seen is that the last 8 years of austerity has cut away at the fundamental infrastructure of state hospitals. We're not set up to deal with what we have to do. And just anecdotally, I know a number of people for whom the economic crunch over the last few years have meant that they'd done away with medical aid. These bills for the middle class are crippling. People have gone into debt. People have increased mortgages on their households. What we're seeing now is basically scrabbling around to survive. And the future for what we're surviving for has yet to be laid out. So I really think it's time for us to say, we've done well. There are things we haven't done that well, but where are we? What needs to be done? And how do we unpack those resources to ensure that it is done? And to have people, ordinary people leading in that conversation. I'm sure on your show, you hear so many stories of people whose lives have been wrecked, who have no control over anything. And if we're wanting to rebuild, we have to hear the true stories of what's going on, not the top level statistics, which just give trends. So I think really what we need to do is we need to admit that over half the population are living without an income. What do we do about that? Why are we vaccinating people if we're not prepared to feed people? What is the wealth of what is the value of the Constitution? How can that direct? And how do we allow people's solutions to come through? Because right now, it seems that those at the top are running out of solutions, and we're running out of time.
Well, on that sobering note, we'll leave it. Thank you so much, Isobel Frye, Director of Studies in Poverty and Inequality Institute, talking to us about how COVID-19 is impacting households, talking about balancing public health regulations while avoiding an economic disaster, or at least trying, and what should be done. That's where we're going to leave it with that. Let's take a quick break.